So I chose my CAT study based on a patient I had seen during my pediatric rotation in Dickinson ISD. Her chief complaint was a runny nose and a sore throat. Patient was a 7-year-old Caucasian female who presented to the clinic complaining of nasal congestion with nasal discharge, cough, and sore throat for 2 days. The mother reported an elevated temperature of 99.5 Fahrenheit. Her ROS was positive for diminished appetite and a headache. The patient denied itchy eyes, ear pain, abdominal pain, nausea, vomiting, and diarrhea. Her vital signs were within normal limits and her temperature was 98.6. Her throat was slightly erythematous with a postnasal drip, but no exudates and no tonsillar enlargement. Her neck did have anterior cervical lymphadenopathy. The rest of the physical exam was unremarkable. We did run 2 labs on her, a rapid strep test and a rapid influenza test, which were both negative. She was diagnosed with a common cold, and she was recommended to drink plenty of fluids, and we prescribed cetirizine 10 milligrams per day for 2 weeks for the patient's symptoms. The patient's mother asked whether or not vitamin C would help the patient's symptoms. This led to my PICO question, which was, concerning patients younger than 18 years old, what effect does vitamin C therapy have on the duration and severity of a common cold as compared to without vitamin C administration? The title of the article that I chose was Vitamin C for Preventing and Treating the Common Cold by Harry Hamilia and Elizabeth Chalker in 2013. The article's objective was to determine whether vitamin C reduces the incidence, the duration, or severity of the common cold when used either as a continuous regular supplementation or as therapy at the onset of cold symptoms. So what the study did was that they included children and adults. The types of intervention included vitamin C for a single day or for a period of time. The primary outcomes measured were 1. The incidence of colds during regular supplementation of vitamin C, and 2. The duration of the cold symptoms. The main findings of this article were regular ingestion of vitamin C demonstrated no effect on the incidence of the common cold, but it did have an effect in reducing the symptoms of a common cold. In children, vitamin C supplementation shortened colds by 18%. In comparison, the duration of adults was reduced by 8%. The severity of colds was also reduced by regular supplementation of vitamin C. Therefore, the conclusion of this study shows that regular supplementation of vitamin C reduces the duration of colds. However, it does not reduce the incidence of colds in the general population. Therefore, with this article, I will advise my future patients who get colds often that it may be beneficial to start a consistent supplementation of vitamin C, since it has been shown to reduce the duration, especially in children, and severity of a common cold. Additionally, this approach to regular supplementation of vitamin C is at low cost and safe for both children and adults. Further research does need to be done, though, to see whether or not that vitamin C administration can be given at the onset of symptoms of a cold. This article shows that vitamin C supplementation every day can help with the duration of cold symptoms. However, it did not really look at whether or not vitamin C at the onset of symptoms would help or not. Thank you for listening.